class. I just want to explain a little bit about week 2. Welcome to week 2. I wanted to say that week 1 seemed to go really well. The health assessments look nice. Everybody did a different format and they all came out nice. All the information was there. As far as discussions go, just please remember to cite and reference each post if you want them to count. And I think some people might think that if they respond to me that it won't count, but if you cite it and you put a reference on the bottom, it definitely counts. So we're in a professional discussion when we are on the discussion board. So this week's discussion has to do with pain assessment for an 82-year-old black male with a headache. It sounds like a new onset headache. So you're going to talk about the assessment that you would do generally, and then the safety measures that you would provide. So I don't think anybody will have too big a problem with that assignment. If you do, certainly email me. And then you're going to do a 3-page APA style paper. I'm going to underline and circle APA style. This is my first class with some of you, and so I will be looking at your APA pretty carefully this week. So make sure that you have looked at the APA 6th edition. There should be a title page. I know that they like an abstract. I don't care if there's an abstract or not on a 3-page paper. So I think as long as you have an introduction, then you don't need an abstract. And just make sure that you do a conclusion, a nice conclusion on your paper. It's just something that will pull the entire paper together. So just pay special attention to your APA style, please. And you are going to do a safety for Mrs. Smith, who is blind in assisted living, has a recent diagnosis of thyroid cancer. She's and has an unsteady gait. So you have a lot to work with there. You can bring that all together generally and focus on one area if you'd like. You can give me some examples. You can tell me about recent technology or something that you've seen work for this type of client, and then you're going to say what questions you'll ask her in a general assessment, and then you're going to describe the physical exam. And we as nurses, we look at patients from the first moment we see them. So even as we're washing our hands maybe in the room, we're taking a look at the patient saying, how are you today? And kind of assessing their responses, if they're accurate, if they're garbled, if you know what type of responses you're getting for patients. So we're constantly assessing, and I'd like you to put that in there. So if you do have any questions this week, please let me know. You have my number. You can text me. But if you do text me, please make sure you say who you are, because I don't have your numbers. You can email me. I generally look at my emails every 24 hours or within every 24 hours, so you should get a response back pretty quickly. So have a great week. I look forward to seeing what you're going to do with your papers. And as I said, if you need anything, reach out. Thanks. Bye.